NCELX Daily Practice Test Part 5. 81. As the nurse takes a history of a 3-year-old with neuroblastoma, what comments by the parents require follow-up and are consistent with the diagnosis? A. The child has been listless and has lost weight. B. The urine is dark yellow and small in amounts. C. Clothes are becoming tighter across her abdomen. D. We notice muscle weakness and some unsteadiness. 81C. Clothes are becoming tighter across her abdomen. One of the most common signs of neuroblastoma is increased abdominal girth. The parents report that clothing is tight is significant and should be responded to with additional assessments. 82. Parents call the emergency room to report that a toddler has swallowed drain cleaner. The triage nurse instructs them to call for emergency transport to the hospital. The nurse would also suggest that the parents give the toddler sips of while waiting for an ambulance. A. Tea. B. Water. C. Milk. D. Soda. 82B. Water. Small amounts of water will dilute the corrosive substance prior to gastric lavage. 83. A 16-year-old enters the emergency department. The triage nurse identifies that this teenager is legally married and signs the consent form for treatment. What would be the appropriate action by the nurse? A. Ask the teenager to wait until a parent or legal guardian can be contacted. B. Withhold treatment until telephone consent can be obtained from the partner. C. Refer the teenager to a community pediatric hospital emergency department. D. Proceed with the triage process in the same manner as any adult client. 83D. Proceed with the triage process in the same manner as any adult client. Minors may become known as an emancipated minor through marriage, pregnancy, high school graduation, independent living or service in the military. Therefore, this married client has the legal capacity of an adult. 84. The pediatric clinic nurse examines a toddler with a tentative diagnosis of neuroblastoma. Findings observed by the nurse that is associated with this problem include which of these? A. Lymphedema and nerve palsy. B. Hearing loss and ataxia. C. Headaches and vomiting. D. Abdominal mass and weakness. 84D. Abdominal mass and weakness. Clinical manifestations of neuroblastoma include an irregular abdominal mass that crosses the midline, weakness, pallor, anorexia, weight loss and irritability. 85. The nurse is preparing the teaching plan for a group of parents about risks to toddlers and is including the proper communication in the event of accidental poisoning. The nurse should tell the parents to first state what substance was ingested and then what information should be the priority for the parents to communicate. A. The parent's name and telephone number. B. The currency of the immunization and allergy history of the child. C. The estimated time of the accidental poisoning and a confirmation that the parents will bring the containers of the ingested substance. D. The affected child's age and weight. 85D. The affected child's age and weight. All of the above information is important. However, after the substance is identified, the age and weight are the priorities. This gives the appropriate healthcare providers an opportunity to calculate the needed dosage for an antidote while the child is being transported to the emergency department. 86. The nurse has admitted a 4-year-old with the diagnosis of possible rheumatic fever. Which statement by the parent would the nurse suspect is relevant to this disease? A. Our child had chickenpox 6 months ago. B. Strep throat went through all the children at the daycare last month. C. Both ears were infected at 3 months of age. D. Last week, both feet had a fungal skin infection. 86B. Strep throat went through all the children at the daycare last month. Evidence supports a strong relationship between infection with group A streptococci and subsequent rheumatic fever, usually within 2 to 6 weeks. Therefore, the history of playmates recovering from strep throat would indicate that the child most likely also had strep throat. Sometimes such an infection has no clinical symptoms. 87. The nurse provides discharge teaching to the parents of a 15-month-old child with Kawasaki disease. The child has received immunoglobulin therapy. Which instruction would be appropriate? A. High doses of aspirin will be continued for some time. B. Complete recovery is expected within several days. C. Active range of motion exercises should be done frequently. D. The measles, mumps and rubella vaccine should be delayed. 87D. The measles, mumps and rubella vaccine should be delayed. Discharge instructions for a child with Kawasaki disease should include the information that immunoglobulin therapy may interfere with the body's ability to form appropriate amounts of antibodies. Therefore, live immunization should be delayed. 88. A 10-year-old client is recovering from a splenectomy following a traumatic injury. The client's laboratory results show a hemoglobin of 9G/DL and a hematocrit of 28%. The best approach for the nurse to use is to A. Limit milk and milk products. B. Encourage bed activities and games. C. Plan nursing care around lengthy rest periods. D. Promote a diet rich in iron. 88C. Plan nursing care around lengthy rest periods. The initial priority for this client is rest due to the inability of red blood cells to carry oxygen. 89. The nurse is planning care for a 14-year-old client returning from scoliosis, corrective surgery. Which of the following actions should receive priority in the plan? A. Antibiotic therapy for 10 days. B. Teach client isometric exercises for legs. C. Assess movement and sensation of extremities. D. Assist to stand up at bedside within the first 24 hours. 89C. Assess movement and sensation of extremities. Following corrective surgery for scoliosis, neurological status requires special attention and assessment, especially that of the extremities. 90. The nurse is teaching parents about accidental poisoning in children. Which point should be emphasized? A. Call the poison control center once the situation is identified. B. Empty the child's mouth in any case of possible poisoning. C. Keep the child as quiet as possible if a toxic substance was inhaled. D. Do not induce vomiting if the poison is a hydrocarbon. 90B. Empty the child's mouth in any case of possible poisoning. Emptying the mouth of poison prevents further ingestion and should be done first to limit damage from the substance. Note that all of the actions are correct, but option B is the priority. 91. The nurse is assessing an 8-month-old infant with a malfunctioning ventricular-peritoneal shunt. Which one of the following manifestations would the infant be most likely to exhibit? A. Lethargy. B. Irritability. C. Negative Moro. D. Depressed fontanelle. 91B. Irritability. Signs of increased intracranial pressure, IICP, in infants include bulging fontanelle, instability, high-pitched cry, and cries when held. Vital sign changes include pulse that is variable, example, rapid, slow and bounding, or feeble. Respirations are more often slow, deep, and irregular. 92. The nurse is caring for a 4-year-old 2 hours after tonsillectomy and adenoidectomy. Which of the following assessments must be reported immediately? A. Vomiting of dark emesis. B. Complaints of throat pain. C. Apical heart rate of 110. D. Increased restlessness. 92D. Increased restlessness. Restlessness and increased respiratory and heart rates are often early signs of hemorrhage. 93. The nurse is caring for a client with sickle cell disease who is scheduled to receive a unit of packed red blood cells. Which of the following is an appropriate action for the nurse when administering the infusion? A. Storing the packed red cells in the medicine refrigerator while starting for. B. Slow the rate of infusion if the client develops fever or chills. C. Limit the infusion time of each of the unit to a maximum of 4 hours. D. Assess vital signs every 15 minutes throughout the entire infusion. 93C. Limit the infusion time of each of the unit to a maximum of 4 hours. Infuse the specified amount of blood within 4 hours. If the infusion will exceed this time, the blood should be divided into appropriately sized quantities. 94. The nurse is caring for a 17-month-old with acetaminophen poisoning. Which of the following lab reports should the nurse review first? A. Prothrombin time, PT, and partial thromboplastin time, PTT. B. Red blood cell and white blood cell counts. C. Blood urea nitrogen and creatinine clearance. D. Liver enzymes, AST and ALT. 94D. Liver enzymes, AST and ALT. Because acetaminophen is toxic to the liver and causes hepatic cellular necrosis, liver enzymes are released into the bloodstream and serum levels of those enzymes rise. Other lab values are reviewed as well. 95. A nurse admits a premature infant who has respiratory distress syndrome, RDS. In planning care, nursing actions are based on the fact that the most likely cause of this problem stems from the infant's inability to A. Stabilize thermoregulation. B. Maintain alveolar surface tension. C. Begin normal pulmonary blood flow. D. Regulate intracardiac pressure. 95B. Maintain alveolar surface tension. RDS is primarily a disease related to a developmental delay in lung maturation. Although many factors may lead to the development of the problem, the central factor is the lack of a normally functioning surfactant system in the alveolar sac from immaturity in lung development since the infant is premature. 96. The nurse is planning care for a 3-month-old infant immediately postoperative following placement of a ventricular shunt for hydrocephalus. The nurse needs to A. Assess for abdominal distension. B. Maintain infant in an upright position. C. Begin formula feedings when infant is alert. D. Pump the shunt to assess for proper function. 96A. Assess for abdominal distension. The child is observed for abdominal distension because cerebrospinal fluid may cause peritonitis or a postoperative ileus as a complication of distal catheter placement. 97. A 6-year-old child is seen for the first time in the clinic. Upon assessment, the nurse finds that the child has deformities of the joints, limbs, and fingers, thinned upper lip, and small teeth with faulty enamel. The mother states, "My child seems to have problems in learning to count and recognizing basic colors." Based on this data, the nurse suspects that the child is most likely showing the effects of which problem? A. Congenital abnormalities. B. Chronic toxoplasmosis. C. Fetal alcohol syndrome, FAS. D. Lead poisoning. 97C. Fetal alcohol syndrome, FAS. Major features of FAS consist of facial and associated physical features, such as small head circumference and brain size, microcephaly, small eyelid openings, a sunken nasal bridge, an exceptionally thin upper lip, a short, upturned nose and a smooth skin surface between the nose and upper lip. Vision difficulties include nearsightedness, myopia. Other findings are mental retardation, delayed development, abnormal behavior such as short attention span, hyperactivity, poor impulse control, extreme nervousness and anxiety. Many behavioral problems, cognitive impairment and psychosocial deficits are also associated with this syndrome. 98. A 15-year-old client has been placed in a Milwaukee brace. Which statement from the adolescent indicates the need for additional teaching? A. I will only have to wear this for 6 months. B. I should inspect my skin daily. C. The brace will be worn day and night. D. I can take it off when I shower. 98A. I will only have to wear this for 6 months. The brace must be worn long-term, during periods of growth, usually for 1 to 2 years. It is used to correct curvature of the spine. 99. The nurse is caring for a 4-year-old admitted after receiving burns to more than 50% of his body. Which laboratory data should be reviewed by the nurse as a priority in the first 24 hours? A. Blood urea nitrogen. B. Hematocrit. C. Blood glucose. D. White blood count. 99A. Blood urea nitrogen. Glomerular filtration is decreased in the initial response to severe burns, with fluid shift occurring. Kidney function must be monitored closely, or renal failure may follow in a few days. 100. The nurse is caring for a client with a colostomy pouch. During a teaching session, the nurse appropriately recommends that the pouch be emptied. A. When it is 1/3 to 1/2 full. B. Prior to meals. C. After each fecal elimination. D. At the same time each day. 100A. When it is 1/3 to 1/2 full. If the pouch becomes more than half full, it may separate from the flange.